So transmission of information by neurons, establishing the resting membrane potential and action potentials. So in order to have an action potential, you first of all have to have a difference in charge across the membrane. So we have to establish this thing called a resting membrane potential. And like I said, almost all cells have a resting membrane potential. There's always a little difference in charge between the outside of a cell and the inside of the cell. Neurons particularly have a fairly large difference in resting membrane potential between the inside and outside. Nerve and muscle cells, what make them unique is they're excitable, okay, so they can change charge or polarity to make them excitable. Membrane potentials are established by different concentrations of ions on either side of the cell membrane. The main ones we're going to talk about are sodium and potassium, okay, with an understanding that chloride and calcium also play a role in this overall establishment of the resting membrane potential, but a very limited role because they have very limited permeability at rest. But we'll see that chloride and calcium play different roles. And you already know, like calcium, what the role it plays in cardiac muscle firing, and we'll talk about chloride and how it influences movement of the synaptic vesicle and release of the synaptic vesicle at the cleft there, that kind of stuff next week. But right now, today we're focusing on just, for all intents and purposes, just sodium and potassium, okay? And then we mentioned that there's these large negatively charged anions that stay stuck inside the cell. So if you take a little micro probe here, stick it into a neuron and compare the outside versus the inside, you get a difference of anywhere from minus 65, minus 60 to minus 90 millivolts, okay? Depending on the nerve cell, the size of it, where it's located, there's a range, but it's usually between that minus 60 to minus 90 millivolts, meaning that the inside is negative compared to the outside, okay? So here we're showing inside versus outside as far as concentrations. And if we look at, let's see if this thing will give me a, it's not giving me a, here, make it into that. Now let's try this. There we go. So here's outside concentration gradients, or concentrations. So if you look at sodium and potassium, potassium 5 millimoles on the outside, so a very low concentration of potassium on the outside, but on the inside, potassium 100 millimoles, so much higher on the inside. And it's the opposite for sodium. Sodium's 150 millimoles on the outside, 15 millimoles on the inside. So basically a 1:20 ratio outside to inside for potassium, and a 10:1 ratio of outside to inside for potassium, okay? So let's talk about the ionic basis for the resting membrane potential. Membrane potential is the voltage difference across the membrane at any given moment, okay, when you measure that voltage difference. I mentioned before that resting membrane potential for a typical neuron, minus 65 to minus 90. Each ion contributes to the resting membrane potential differently, depending on what's called its electrical chemical potential, sometimes called the Nernst potential, and its individual membrane permeability. So how permeable that ion is at any given moment contributes to that, and the concentration difference. And it's an electrical chemical gradient here because these are charged particles, right? So you've got not only concentration, but you've got the electrical charge that influence these ions and how they're going to move or not move across the membrane. So how do we get this resting membrane potential with these ions? So the key thing, the number one thing, is this active transport of sodium and potassium, okay? So you get, for every time that sodium potassium or channel pump, whatever you want to call it, does its thing, 3 sodium ions go to the outside, 2 potassium ions come to the inside, okay? So even though they're both positively charged ions, but you're pumping out more positively charged ions, 3 positive charges for every 2 you're bringing in, you're establishing concentration gradients for sodium and potassium, because if you're pumping sodium out, it's going to be more concentration on the outside, less on the inside. You're pumping potassium in, there's more potassium on the inside than the outside, okay? So you've got not only this electrical difference is being established because you're having a net deficit of positive charges on the inside because you're pumping 3 sodiums out for every 2 potassiums, but you're establishing concentration gradients too for those 2 ions with much higher concentration of sodium on the outside and much higher concentration of potassium on the inside. Make sense? You also, though, have some passive diffusion that's going on. You have these pumps that are creating this difference, but there's some leak channels. There's some channels that are open and allow some sodium and a lot more potassium to be constantly leaking across the membrane at any given moment, in addition to that pump in the background always trying to crank those, reestablish that resting membrane potential, okay? So those influence this resting membrane potential. Potassium ends up being the most heavily influencing factor in that resting membrane potential being closer to that minus 60 to minus 90 millivolts. And we'll show you why here in a second. Because it's leakiest. It can passively diffuse all the time in the background a lot more easily than sodium can. And so you're going to be closer to that resting, that equilibrium potential of potassium because of that, because it's going to have a much bigger influence over the resting membrane potential because it's relatively permeable. But then you also have those negatively charged anions. Don't forget about those. These proteins and organic phosphates and sulfates that are trapped inside the cell that are negatively charged. So they help contribute to that negative charge on the inside. All right. So sometimes it's easiest to look at these individually. Okay, this how sodium and potassium contribute individually to this resting membrane potential. So let's just look at them one at a time, and let's set up this kind of artificial contrived cell, that we'll do this with. So let's start on the left. Let's look at potassium first. So we've set the cell up like it is when the sodium potassium pump has done its job, and we have this larger concentration of sodium represented by the larger K, the smaller concentration here. We have some negatively charged anions on the inside, some on the outside too. So we have this setup here, and we have a cell membrane that's not allowing any movement right now of those ions across that cell membrane. Okay. So now let's say we insert a protein channel that allows potassium, that's specific to potassium, to allow just potassium to move across the cell membrane. Well, potassium is going to want to move because there's a concentration gradient, right? There's a large concentration gradient right now because there's a lot more on the inside than the outside. So potassium is going to start to move across down its concentration gradient, right? And as those potassiums move out, those are positive charges leaving the cell, right? So now the inside is going to become more negative compared to the outside because you're losing those positive charges. Does that make sense? Okay. And so you can start to see how you're getting more positive on the outside and more negative on the inside, okay? Because those positive charged potassiums are moving out. Eventually, though, what's going to happen is your concentration gradient is going to start to decrease, right? Because you're equalizing the concentration. But at the same time, this is a charged ion, and so electrical gradients are going to influence it too. Because right now, the concentration gradient is so great that the concentration gradient is stronger than the electrical gradient because like charges repel each other, right? So this potassium is moving into a more positive environment, even though it doesn't want to go into a more positive environment from an electrical standpoint, but the concentration gradient is so strong it's still drawing it out. So what's going to happen eventually is it's going to get so positive on the outside and so negative on the inside that potassium, even though there still may be some concentration gradient going on, it's not going to want to move out anymore because it's the positive charge outside environment is repelling it, and the negatively charged inside environment is keeping it there. It's attracting it to that. Okay, so that's the electrical gradient influences. So you have both, and where that balance point that happens for potassium is right in that minus 65 to minus 90 millivolts. When the inside of that cell gets to that minus 60 to minus 90 millivolts, it doesn't want to move anymore. Okay. And in a normal neuron, you have a lot of these a lot more of these leaky potassium channels that are freely open to allow this to occur in the background. Remember, though, you always have the sodium potassium pump working nearby that's always trying to pump, more potassium in and more sodium out that maintains this, that helps maintain that resting membrane potential, even though potassium eventually is wanting to, it's trying to leave the cell through this freely, through these open channels. Then sodium is the opposite. So here's sodium out here, higher concentration on the outside. Let's put in just a sodium channel. It's going to want to move down its strong concentration gradient initially. So now we have sodiums moving in, and then eventually when the sodiums will stop because the concentration gradient will drop, but the electrical chemical gradient will also change, because as you're moving down this way at the concentration gradient, you're moving positive charges in here, and it'll eventually get so positive here that sodium doesn't want to go into that positive environment, and it'll get negative enough on the outside that it wants to keep those sodiums out there so they don't move any further. Okay? And where that occurs, this balancing point for sodium occurs at a positive 62 millivolts. So that's what's called its equilibrium potential. That's where it establishes equilibrium, is at positive 62 millivolts. Okay. So if sodium and potassium each had equal influence over that resting membrane potential, you could see that the positive 62 millivolts, this thing's taking me off, positive 62 millivolts would kind of almost cancel out that minus 7. So why wouldn't it be closer to, minus 10 millivolts or something like that? Why is the reason is the resting membrane potential much closer to the potassium's equilibrium potential than it is to sodium's potential? I kind of mentioned it earlier. Yeah, in reality, you have in reality, this isn't occurring really very much. There's not a lot of leaky sodium channels. There's not a lot of sodium channels that are open freely to let sodium do that. So, but there is for potassium. So potassium has a much bigger influence over the cell's resting membrane potential because it's allowing this to occur all the time in the background. Okay, where sodium doesn't influence the resting membrane potential as much. This has nothing to do about action potentials yet. This is we're just setting up this resting membrane potential, okay? But always in the background is we got that sodium-potassium pump, kicking out sodiums, bringing in some potassium, but potassium in the background is always leaking back and forth. That's close to this. That's why you have that resting membrane potential closer to that minus 70 to minus 90. But you also have those large negative anions that are stuck in there too. But sodium, when it gets pumped out, it can't leak back across. So it doesn't contribute very much to that resting membrane potential, okay? Because the permeability really influences how much it can contribute. You don't have to know the Nernst equation here, just that it involves the concentration on the inside versus the outside of the charged anion, or charged particle or molecule. And it's a logarithmic function, but that's just don't worry about that. But just wanted to show you that involves the concentration inside versus outside is important for that. If you want to get really fancy, there is yeah. Eventually, but it would still go in enough that it would get more, because there's still negative anions in here, and this thing is wrong. This should be a larger A here and a smaller A here. Does that make sense? Yeah. So if you want to actually calculate what the resting membrane potential is of a cell, when you factor in all the ions that are involved with this, is you have to know some different things. You have to know the concentration on the outside versus the inside of all of those different, like sodium, potassium, chloride. You could put calcium into this equation. But you also have to know things like permeability of the membrane. You have to know the universal gas constant, what the temperature, because the temperature will influence how fast ions move in that environment, and that's how you can get this actual more specific resting membrane potential if you know all those things. So I call it the Goldman-Hodgkin-Katz equation. So from what you need to know now is just that the resting membrane potential is established by that sodium-potassium pump, those negatively charged anions that are stuck in the cell, and the fact that potassium is allowed to leak back and forth kind of in the background. Okay? That's for the resting membrane potential. So now we got to talk about changes in resting membrane potential. That's what's going to lead to an action potential, potentially. The resting membrane potential prepares the cells for changes in electrical potential. When a cell is depolarized, it becomes less negative on the inside or more positive on the inside. It gets closer to neutral, you know. When it's hyperpolarized, it actually becomes more negative. That's when a cell is or a neuron is harder to make it generate an action potential if it actually becomes even more negative. The bigger the difference in charge, the harder it is to generate an action potential. Okay. So in establishing this membrane potential, you know, and initiation of action potentials require movements of these ions, which we've been talking about the movement of these ions across the cell membrane, going back to basic chemistry here and that kind of stuff. And diffusion is one way that these ions move, and then also active transport. So diffusion, a couple different types of diffusion. There's simple diffusion, which is just something moving down its electrical gradient or chemical gradient or electrochemical gradient if it's a charged particle that just moves it naturally, or a facilitated diffusion where you use another molecule to help something even move against its electrical potential gradient, but you have to use another molecule that has a chemical or electrical gradient to do that or help you do that. Okay. Both of those don't require energy. These two don't require energy for that type of diffusion. Then we have active transport. Active transport does require energy. That's the sodium-potassium pump. That's a form of active transport. You're moving molecules against concentration or electrical gradients, so it requires energy to do that, to move these things against their natural tendency and gradients. So simple diffusion, based on these concentration electrical gradients, can occur. Some can occur directly through the lipid bilayer. So like oxygen, nitrogen, carbon dioxide, they're small enough molecules and they don't have enough charge to them that they can just go right through that lipid bilayer, pierce right through it, and move right through it pretty easily. Then there are some can occur through protein channels. Most ions and lipid insoluble substances move through some type of a channel. Okay. Some of those channels may be non-gated, just an open channel. And some of those channels may be very non-selective. They'll allow any molecule of a given size to move through it, you know. But some of those channels are open, but they're more selective. They'll only let certain molecules move through that open channel. There's modality-gated channels, so a certain temperature. When it gets to a certain temperature, the channel may open. Or if you push on it and move it mechanically, that opens the channel, okay. There are ligand-gated channels, which are channels that are driven by some type of a ligand, which is typically a neurotransmitter, binding to this channel to open or close it. Okay? And then voltage-gated. So a change in voltage nearby will make that channel open or close by the change in voltage. Those are the different types of channels that can allow things to move through the cell. So here's a ligand-gated, which we'll talk about more on Tuesday. Ligand-gated with a neurotransmitter binding to a protein channel and causing it to open, okay? At least temporarily. That's usually a pretty brief thing. Once that ligand detaches, then it's got a little bit of a timing mechanism, then it's going to close within a certain number of milliseconds after that, you know, happens. Voltage-gated. So if you look here, here's some positive and negative charges on outside versus inside of the cell. But if we get a flip-flop of charges, so if the charge, that causes the protein channel to open, that change in the charge near that protein channel. Here's a modality-gated, and this happens to be one that's stimulated by stretch or pressure. So these might be some little bit of neurofilaments here, or microfilaments that are attaching to the ends of that protein channel. The cell membrane gets stretched and pushed on, and that pulls open, literally mechanically pulls open the channel and allows whatever to move through that, okay? And then things that we can move through that through simple diffusion, okay? You have to have an electrical gradient or concentration gradient or combination for things to move through those open channels. Then there's this thing called facilitated diffusion. It's also sometimes referred to as carrier-mediated diffusion. You get a conformational change of a carrier protein molecule, allows an ion to cross the membrane, but the rate is limited by how fast the protein can change. And the rate of even simple diffusion is limited by how many molecules can move through, how big the opening is and so forth, and resistance to that. But we'll show you an example here. The example is glucose and most amino acids that get into your cell. In order to get glucose into your cells and most amino acids, you have to use facilitated diffusion in a form of what they call co-transport. And it requires a concentration or electrical gradient for this still to happen. Okay. So here's an example. You have this protein channel. Okay, it doesn't look like a channel here, but let's assume it's like a channel. And this protein channel has binding sites for both sodium and glucose. Okay. This protein channel will only do its conformational change to allow passage of these molecules when both of those sites have been filled, one by a glucose molecule, one by a sodium molecule. So what glucose, even if let's say there's a concentration, there's higher concentration of glucose inside the cell, so glucose doesn't really want to move that direction, but it's going to use sodium to help it move that direction. It's actually going to use sodium's concentration gradient to help it move into the cell, because sodium wants to move into the cell, right? Because you've established a concentration gradient for sodium with that sodium-potassium pump. It's much higher sodium on the outside. So glucose is going to catch a free ride from sodium to get into the cell. And so once that's bound there, it's going to use that. And this is a facilitated diffusion. This is co-transport of two molecules, glucose using the sodium's concentration and electrical gradient to get across into the cell, even if there's a higher concentration of glucose already in the cell. Does that make sense? So factors that affect this rate of diffusion is and for facilitated diffusion, it's how fast you can get that protein channel to make its change, spit the glucose and sodium out on the other side, then reset and get ready to do it again. And we'll determine how fast that can occur. That's how for facilitated diffusion. But other things that affect rate of diffusion is the permeability of the membrane, the differences in the concentration. The stronger the difference, the faster things and the more strongly things are going to want to move. The stronger the difference in electrical gradient, that's going to influence how fast and things are likely to move through. Okay. So those are types of diffusion, simple and facilitated diffusion that don't require energy. But then we have active transport, and this is the key thing in neurons for setting up this difference in charge. This is always happening nonstop, even during action potential. There's always in the background this active transport of sodium potassium pumps working to reestablish the resting membrane potential. So as soon as you get an action potential, these guys are already working in the background to, as quickly as you can, reset so you can generate another action potential if you want to. You got to reestablish that resting membrane potential to get another action potential. So here we are. You know, the protein channel changes. 3 sodiums bind, 2 potassiums are released. You have a conformational change in that requires energy, ATP. Those little mitochondria are cranking out ATP to make this happen. And then when it has that conformational change, 3 sodiums go out of the cell, 2 potassiums are bound again in this, and then it does that again, and it spits the 2 potassiums back into the cell. Okay, does that make sense? So the pump, sodium potassium pump. There's also a calcium pump that does a similar thing. Okay. But we're just focusing on sodium potassium for the action potential right now. So we're always spitting out more positive charges than we're bringing in. But then remember, in the background, potassium's leaking back because there's a lot of open channels for that. That's why your resting membrane potential stays closer to that potassium's equilibrium potential that we talked about. So there's some leaky potassium channels that are always happening in the background as well. So now we're going to start getting into these what we call local potentials versus then an action potential. Okay, local potential versus an action potential in a neuron. So what's the difference? A local potential or a graded potential are smaller changes in membrane potential in a localized region of the neuron that may or may not lead to an action potential. If you get enough local potentials that sum up to a certain threshold, then you might get an action potential in that neuron. Okay? So these are little regional changes in the potential in somewhere on the neuron, the dendrites typically, or it can be on the cell body where other neurons are connecting to it. Causes a little bit of depolarization. But if you get enough of these depolarizations all nearby each other at about the same time, then it can create enough of a change in the total resting membrane potential that you get to this point we call summation, where you get to the threshold value that then causes this cascade of events to lead to a full action potential. Okay? And then the action potential is this brief, large, it's an all or none response. Once you achieve this threshold value in the neuron, then what happens is you then get these opening of all the voltage-gated sodium channels. That's the key event. You're trying to get the voltage-gated sodium channels to all open at the same time. And those don't change until you reach a very specific threshold value. You have to have these local potentials that have to add up to enough to get the sodium, the voltage-gated sodium channels that are actually located in that little initial segment of the axon hillock. That's where they're most highly concentrated. That's what's going to start the action potential at that axon hillock in that initial segment. So then it's going to directionally go down the axon from there. Okay. So here is what's called spatial summation. So let's say you have, here's a little oscilloscope and it's measuring the membrane potential. Okay. Here's normally we're at a minus 70 millivolts. Here comes a signal from a nearby neuron. It releases some neurotransmitter onto the cell body here. That neurotransmitter binds to a few ligand-gated sodium channels, opens some sodium channels in this region, some positive charges, some sodium channels move across the cell membrane just in this little region right here. And you see this little spike gets a little more positive, right? It goes from minus 70 to say minus 60 millivolts. It got a little more positive within this cell, but not a lot because it's only happening right there at that little spot. Well, if you happen to have multiple connection points that all are near each other, and this is all happening at about the exact same time, so there's several neurons nearby that all those signals come by, and they drop little neurotransmitter, and ligand-gated sodium channels open up all kind of nearby each other. Well, these all sum up. They're all happening about the same time. So now we get this much larger local potential. We might be getting up to minus, this might be minus, say 60. This might have been minus 65. Now we're minus 60, minus 55 almost maybe. But we're not quite the threshold value to get the axon hillock and the voltage-gated sodium channels to open up fully, okay, down at the axon hillock in that initial segment yet. But this is called spatial summation. So this is a bunch of them all nearby arriving at about the same time. Okay, that's one way we can get that. Then we have temporal summation. And this has to do, here's a neuron nearby that's sending multiple action potentials closely spaced to each other. And so what's going to happen here is you're going to keep dumping more neurotransmitter in there. It's going to keep opening more sodium channels in this region for a longer period of time and allowing more sodium to get into the cell. And so you'll see this little, with each new impulse or action potential that comes from this neuron close by, you're getting an increased amount of sodium coming into the cell. But it's a timing thing. It's how they're coming in quick succession. And so you're getting more sodium coming across, but it's all in that one, it's all right here at this one spot. But it's still contributing to an increase in, number of sodium ions getting in, which makes it more positive on the inside. That's temporal summation. Most of the time you have a combination of both spatial and temporal summation. So when neurons are communicating with each other, they're sending multiple signals all at the same time in a nearby and onto a similar cell, or concentrating their efforts and their signal. And so you get usually some combination of spatial and temporal summation. That these are all local potentials. Okay, these are all local potentials. These are all local potentials that they could lead to an action potential if you reach a certain threshold value. Okay, so if you get this resting membrane potential to get all the way up to typically around minus 55 millivolts, that's when in that axon hillock, where you have a bunch of voltage-gated sodium channels. These are all mostly ligand-gated sodium channels, okay, that are stimulated by a neurotransmitter, okay, from another cell. But that's when you get the voltage-gated sodium channels to open up, and that creates the action potential to be propagated down the axon, okay? So now we're going to talk about the action potential. So if we get spatial and temporal summation of those local potentials, okay, then we can eventually maybe lead to an action potential, okay? These are the important elements. You get a threshold stimulus, you get depolarization, which is the rising phase, okay, because it's getting more positive. And you actually overshoot zero. You actually get even more positive because you're so rapidly bringing in sodium, it just keeps rushing in. It goes above zero. That's the overshoot. And then you have repolarization, where you're getting the resetting of the resting membrane potential. It's the falling phase. And it actually goes a little negative. You get rid of so many sodiums getting pumped back out and moving back out, and potassium is moving out, that you take so much positive charge out, it gets even a little hyperpolarized and goes a little bit below resting membrane potential briefly for a few milliseconds, and then it goes back up and reestablishes its full normal resting membrane potential because of that sodium-potassium pump working always in the background. We'll talk about an absolute refractory period and a relative refractory period. So there's a time during the action potential where you could not generate another action potential in that neuron, okay? But then there's also a relative refractory period where you could generate another action potential, but you have to actually have a stronger stimulus. You have to have a stronger local potentials to add up to get even maybe a little bit more than minus 55 millivolt. You might have to go up to minus 60 millivolt to get it to actually send another action, or create another action potential. So we'll show you guys that. All right, so let's talk about the action potential. So if we get enough local potentials where we get some change in membrane potential that gets us up to this minus 55 millivolts, that's the key threshold. And that's going to allow then, or stimulate, our voltage-gated sodium channels to all, boom, just open the floodgates and let lots of sodium now into this, right in that axon hillock, that initial segment of the axon hillock. That's what's going to allow all that sodium to rush in right at that spot, okay? That's going to initiate the action potential. And then we're going to have this rapid depolarization or rising phase that's going to get much more positive because we caused voltage-gated sodium channels to open. So, man, all these positive charges are going to be rushing in, okay? They rush in through open sodium gates due to the large concentration and electrical gradient. There's both a large concentration and electrical gradient, right? Because it's negative on the inside of the cell. So they want to rush into that negative environment, plus it's much more concentrated, sodium's much higher concentration on the outside, so they want to go down their concentration gradient. So, man, they just pile in there. Now the inside of the cell becomes more positive, and so they don't want to go in there as much, okay? If threshold reached, voltage-gated sodium channels open. We already talked about that. Potassium channels. We do have some leaky potassium channels, right, that are always in the background, but we also have some voltage-gated potassium channels as well, okay, that are remaining closed during this process. They don't activate or do anything right now. Just the sodium channels open first. There's a delay before any voltage-gated potassium channels start to open, okay? So right now, during that rising phase, just potassium channels are wide open, positive charges rushing in right at that axon hillock initial segment. Boom, it's getting much more positive. So here you see this rapid rising phase, okay? And this is happening so strongly, these sodium channels moving down their concentration gradient and electrical gradient, that they exceed and get much more positive, up close to sodium's equilibrium potential, which is a positive 62 millivolts. This is showing it up around 40 millivolts. It doesn't really matter, but it goes up past 0, okay, and overshoots. Then what happens is sodium channels, voltage-gated sodium channels now start to close, and at the same time, the delayed potassium, voltage-gated potassium channels now that had a delay on them, they open, okay? So now sodium can no longer pass through, but now the potassium channels open, and now we allow potassium to rush out. And potassium wants to rush out because there already is a strong concentration gradient, but also now it's gotten much more positive on the inside, and positive ions, you know, want to get away from each other, so potassium wants to rush out for its electrical and chemical gradient, okay? And so now you're losing those positives, those potassium, positive potassium ions. But remember, in the background, that sodium-potassium pump is always working, and so its background also pumping out sodium ions too. So that's also going to help somewhat, but it doesn't help as quite as fast as this. This is a very fast mechanism to open these potassium channels to allow potassium positive charges to move out of the cell, okay? And so that's what you're going to have here. Is now it's going to become much more negative. So you get this repolarization. This is getting, the inside of the cell is getting more negative because you're losing all these positively charged potassium ions rapidly. Just the floodgates are open for the potassium to rush out. The sodium had just rushed in previously. It's in there. It's beginning to be pumped out. It's not fast enough to get this fast of a decrease. It's the potassium going out that's going to reestablish that resting membrane potential more quickly. It's potassium rushing out. Does that make sense? And it rushes out so quickly that it actually goes slightly below the resting membrane potential. Like in this case, it's minus 70 millivolts. It might go down to minus 80 millivolts because it just, there's such a strong concentration electrical gradient, it actually rushes out and over kind of has a, you know, over polarization, you know, hyperpolarization that occurs there briefly, very briefly. These are milliseconds, 1-2 milliseconds here. Now we have this hyperpolarization, and then we return back to the resting membrane potential. So what now happens is all the electrical gated, voltage gated sodium and potassium channels have closed and reset. And now we just have in the background, we have our sodium potassium pump doing its thing, you know, kicking out 3 sodium ions, bringing in 2 more potassiums, and we have our other leaky potassium channels that are already always in the background that are just leaky to potassium. That's how we get back to our resting membrane potential of about minus 70 millivolts for this particular neuron, okay? And that happens fairly rapid. It takes a few milliseconds, but then eventually gets back up to its resting membrane potential, okay? This is just a little thing showing you what's happening during the different parts of this, of the action potential. You know, during this part right here, this initial part is the sodium channels start to open. The voltage-gated sodium channels start to open. It's rising very quickly and more to basically all the sodium channels open. And then right at the peak here, that's when sodium channels begin to close. They're not all closed yet, but they start to close. And this is when potassium channels start to open, and they stay open this whole time to get it to repolarize, and then right here is the potassium channels close, and now they're both closed. You know, sodium potassium channels are closed, and then this is the sodium potassium pump reestablishing a resting membrane potential. Let's talk about this thing called refractory periods of when you can or can't generate another action potential in a given neuron. So during this rapid rising phase and during the very first part of the falling phase, no matter how much you try to stimulate that axon hillock, that initial segment again, you couldn't generate another action potential. You can't superimpose another action potential directly on top of an action potential. during this particular phase, okay? Once it's dropped about halfway down, and as you're in this hyperpolarization phase 2, you could generate another action potential, but it's going to require you having a much larger local potential or threshold value to achieve to get that to happen, especially during this hyperpolarization phase right here. So you see when you're hyperpolarized below your normal resting, so a normal threshold stimulus is minus 55 millivolts, right, to get those voltage-gated sodium channels to open. If you try to stimulate that neuron again to generate another action potential when you're in this phase right here, so minus 55 millivolts might be up here. So normally you'd only have to change a little bit, right? Only 15 millivolts, okay? But if you're down here, like at minus 60, now you got to change. You have to have a much bigger change in that, to get to that threshold stimulus. So because you're already much more negative, so you have to have a much more local potentials, more positive ions coming in from another cell that's driving, that's communicating with it to stimulate another action potential at that point, okay? And the reason you have this absolute refractory period where you can't have another action potential, that's so you can actually have directionality in the action potential. So your action potential, when it starts in that initial segment, it can't go backwards. It can only go down the axon that way, because once the initial segment and all those sodium ions rush in at that moment, those sodium channels are open briefly, but then they close and they're actually locked down for a little bit where you can't re-stimulate them again until you cross this point right here. You can't reopen them again, and that makes sure that you can't have the charge go the opposite direction. So you can't reopen those voltage-gated sodium channels at the initial segment briefly, so it only can be the ones downstream from it. So that's how you can get the action potential to propagate down the line and continue to flip-flop those charges all the way down the end of the axon. Does that make sense? And continue to open voltage-gated sodium channels down the line of the axon, and it can't then go backwards. Does that make sense? That's how you get this directionality of signaling in the nervous system, is that absolute refractory period doesn't allow you to generate an action potential going back the opposite direction, because as it goes down, there's a little temporary blockage where you can't reactivate or reopen those voltage-gated sodium channels, so it has to go down the line to the ones downstream from it. Okay? We talked about relative refractory period, so where you can stimulate another one, but it takes a stronger stimulus to do that. How many more slides do we have? Let's do this. Let's take a real quick break here. Yeah, let's take a real quick break. We'll come back and we'll probably be done, we'll be done probably by whatever, 11:30 the latest. So let's just pause there. Then we'll come back. Think if you have any questions when you come back, if you need to clarify anything we just talked about. All right, so we talked about, you got to establish this resting membrane potential, right? These neurons have this resting membrane potential. That sodium-potassium pump, little leaky potassium channels, that's what keeps it there. You get local potentials from whatever, other neurons nearby, depositing some neurotransmitter on some ligand-gated sodium channels that get some positive charge going into that neuron. That neuron, if it gets enough positive charges in it to a threshold value, makes that initial segment at the axon hillock where it has a bunch of big concentration of voltage-gated sodium channels, boom, they all open up, sodium rushes in temporarily, things get more positive, and then the sodium channels close, potassium channels open, all the potassium rushes out to reestablish that resting membrane potential, those close, and the sodium-potassium pump gets everything back to hunky-dory as far as that goes. And that process, though, once that initial segment happens, it causes the voltage-gated sodium channels down the line to keep doing that to propagate this action potential down. This could be a 3-foot-long axon to keep generating that signal down by continuing to open these voltage-gated sodium channels on down the line, remembering that temporarily they close and you can't be reopened, so the signal can't go that way. It only can go that way down to the active voltage-gated sodium channels that have the ability to be reopened. Okay. So there are some things that affect how the action potential is propagated down the axon. Okay, how fast this occurs is what we're talking about mainly. Okay, that spreading of that. There's three basic factors that affect how fast. It's the axoplasmic resistance. That's the resistance within the axoplasm itself to the spread of charge down the axon. Okay, charge will spread passively a certain amount of distance in any given environment, and moving electrons and all. And this was also physics. I hated the electrical stuff. It seems so theoretical to me. But anyway, but charge will move passively a certain distance, and having a little more space in an axon allows that charge to move a little passively more easily, kind of like a garden hose. The bigger the hose, the easier, more water you can move through that garden hose. The molecules aren't bumping into not as much friction, so to speak, but we're talking about friction of charge or movement of molecules and charges. So the larger, the diameter of an axon, the less axoplasmic resistance you have to movement of charge passively down the axon, okay, for propagating that action potential. So we also have membrane resistance. That's the resistance across the membrane of charge to move across the membrane. And then membrane capacitance, which is the ability to store charge across a membrane. And this gets a little kind of counterintuitive at times, so I'll try to explain it here in a second, and I'll show you examples. So membrane capacitance is the ability to store an electrical charge across a membrane. There's two characteristics of nerve fibers that affect the above. The diameter, okay? The larger the diameter, the less the axoplasmic resistance, which if you decrease the resistance of the movement, that makes it easier to move. You're not being resisted, so you can just move right down. The charge can spread more easily in a bigger tube, a bigger axon. Charges can move more easily, just like I said with the garden hose, okay? The other big thing that affects the axon is the myelination. If you have a myelinated axon, the more myelin you have an increase in membrane resistance, which is actually a good thing. Okay, you make it more difficult for any charges to move across. There's a physical barrier there. Charges can't move across that area. They physically can't move across that area. And you also decrease the membrane capacitance, which is you can't store charges across that. They're physically separated far enough away from each other that the positive and negative charges are far enough away that they can't influence each other, so you don't store charges in those areas, okay? So it's not going to make sense yet. It will in a second here, what that all means. So let's just go to the next slide here. So here's a propagation in let's talk about an unmyelinated axon first, okay? So here's your unmyelinated axon. Here is your normal setup of, more positive on the outside, more negative on the inside. But here's our action potential where you start to get the axon hill like a flip-flop of charges, sodium channels, voltage-gated sodium channels open. And what would happen in this case is that you would have to basically, if you have no myelin, you have all these voltage-gated sodium channels lined up, you are actually able to store charges across the membrane. There's no physical barrier there, so you have all these sodium and ions lined up across there, and these positive and negative charges that are all right near each other. And what happens is you have to have basically this flip-flop and opening of charges. Every sodium channel voltage gated has to flip-flop and open in sequence all the way down the line, and that takes time. Okay, that takes some time for all those to do that. And so that's what they're showing here, is it's going from one, the next voltage-gated sodium channels get stimulated open, and the next, and the next, and the next. But you're storing all this charge all along that axon, which you think would be a good thing, right? But it actually, it gets in the way of the natural spread that electrical current can happen, and you don't need that to actually occur to do that, okay? But that's why unmyelinated axons transmit information more slowly, because you have to have this flip-flop of charges, one after the other, in sequence, without allowing just natural kind of spread of electrical charge to occur. And I'll show you in a second what we mean by that. So now here's what happens when a myelinated axon, okay? So in a myelinated axon, here's our myelin, a Schwann cell, a oligodendrocyte, depending on if we're in the peripheral or central nervous system. So it creates this physical barrier between the inside and outside of the cell. And so what happens is you actually don't store charge, on either side of that because they're physically separated. There's a separation between the positive and negative charges from the outside to the inside, and you're not storing charge across here, okay? So that's why you only see at these points. These are the nodes of Ranvier. So every so often, there's a little exposed area of the axon that allows storage of charges and where you have voltage-gated sodium channels. So here we had our axon hillock and our initial segment, say right here. And this is where we do have some positive and negatives and inside. So that thing flip-flops. That charge flip-flops. We get sodium rushes in, it gets more positive on the inside, generate the action potential. That positive charge will spread on its own a certain distance without having to open any other sodium channels nearby. So there's a certain amount of distance that positive charge will spread without you having to have anything open up nearby. And the myelin is really smart. It's just the right length that it knows the optimum distance that you can have charge passively spread to then stimulate the next little node of Ranvier that has voltage-gated sodium channels to still open, okay? And so what you do is just like skipping. It's like skipping this whole area. You don't have to have this flip-flopping of charges where they're kind of almost bumping into each other, and having these sodium channels open in exact sequence all the way down the line. So you get a few voltage-gated sodium channels to open. That positive charge that as the sodium rushes in, it'll passively spread. And actually having it passively spread is faster than having to do all this flip-flopping. It'll passively spread enough down that little spot that the myelin is covering to stimulate the next node of Ranvier, which has voltage-gated sodium channels, to do its thing and then propagate the charge down the next one. So it makes it a little faster. It actually gets that charge and gets that to occur faster than having all these voltage-gated sodium channels open in sequence and kind of almost interfere with each other in some ways. It slows down the propagation of those charges. And this is that saltatory conduction of bouncing from one node to the other basically through the passive spread of charge, a certain optimal distance that charge can spread, okay, before you lose it. So, and then what happens too is, so that's why when you lose that myelin, you slows down your conduction. The other thing that myelin does is actually, it increases the diameter, in a sense, of the axon because it doesn't really, the axon itself right here is not, the diameter isn't increased, but the thicker that myelin is, that's essentially like making a larger axon because it will spread faster because there'll be less storage of charge across that depending how thick that myelin is. As the myelin gets thinner or damaged, then you start to get some storage of charges across that will slow it down, the process of the natural spread of the electrical current. So, I mean, analogy I can think of is like if you take Velcro, and like the Velcro is like the charges that are all sticky together, the positives and negatives, and if you like take that Velcro and you really smush it together and just all the way down the line like that, you take two pieces of Velcro, and if you try to like rip it apart and you smush it all together all the way along, it's really hard to, it's like pulling, it's really much harder to pull apart. All these little things are interacting. The hook and the loop are all interacting. Well, the positive and negative charges are all interacting, and you can't get it to spread very fast. But if you take that Velcro and you just pinch it here, you pinch it here, you pinch it here, and then you go rip it apart. It's a lot easier to rip apart. Those are the nodes of Ranvier. All you need is those interaction of just those little voltage-gated channels at those nodes to keep that process going. Okay. And so that's why, with the myelin, we're increasing membrane resistance. So this is providing resistance. We can't get across that. It's increasing the resistance for charge to move across that membrane. That's a good thing for as long as you have those nodes around VA. We want to increase membrane resistance for those so charges can't move across there, because we only want it to happen at these nodes around VA, so it happens faster. And then also it decreases membrane capacitance. Capacitance is the ability to store charge. So you can't get these positive and negative charges to line up there. You've decreased the capacity to store charge right there, because they're physically so far apart, the positive and negatives, they don't care about each other in that region. They only care about in these regions where they can get close enough to each other to influence each other. Does that make sense? So that's the membrane capacitance, that we've actually decreased capacitance, increased resistance in just the areas where the myelin is. And that allows you to spread the charge to the next node around VA faster. Hopefully that makes sense. Just some general things about the interactions between neurons. Diversity as well as specificity of the nervous system can be attributed to the connections of the neurons. So, we may have certain processes within our nervous system where we want to focus a signal. And so in that case, you might have multiple neurons that all interact with a single neuron and actually strengthen the response of the single neuron, but it's focusing a signal, for whatever reason. To store a memory, to focus the signal for a certain motor pattern you're trying to learn or develop. There might be other times where we have neurons that get more diffuse, okay, and actually spread a signal because you're wanting to go to different regions, or you're wanting to spread the signal or something like that for some particular reason in the nervous system. And some of this is involved with neuroplasticity. When we do things through learning, through having chronic pain, these are the things that can happen. The nervous system can change and either focus or get more diffuse in its signal. Sometimes with chronic pain, you get overactivity and diffusion of signals where you get spread of pain and overactivity from a single neuron being stimulated, and it normally would not cause that much pain, but over time it's generated all these connections that cause a heightened or hypersensitive type of pain response because of this disperse. So we have what's called, this is convergence and then divergence. So convergence is multiple inputs into a single axon, and divergence is a single axon branching out multiple connections. We already talked about the clinical considerations here. We mentioned Guillain-Barré, multiple sclerosis, and influencing myelin. Guillain-Barré in the peripheral nervous system, multiple sclerosis in the central nervous system. With Guillain-Barré, so typically the onset is distal to proximal. So what happens is when you start having Guillain-Barré, you first notice it in your feet. Like all of a sudden your feet aren't working, you can't lift your toes up. And then next thing you know, your knees, then your hands, and then your elbows, and then your breathing. That's what you don't want to get to, because it actually can affect the peripheral nerves that go to the respiratory muscles, and that's what can kill you with Guillain-Barré. Guillain-Barré itself doesn't kill you, it's just the ability can't breathe. So as long as you want to get to a hospital, have a ventilator nearby. Not everybody needs a ventilator, but they want to watch you and monitor you, so if you start to have respiratory problems, they want to intubate you. But the reason it starts distal is that as the myelin starts to degenerate or get damaged, not fully damaged initially, so the signals are still being propagated, but they're just not as strong, and it's harder to get them to the farthest places, right? So there's a better chance you're going to lose the signal when the myelin and the Schwann cells start to get damaged, to not make it to the more distal regions, because it's harder to send a signal a longer distance, right? So you really got to have that good insulation. So if you start losing that insulation, it's the distal muscles that are going to start to feel it first. Then as it gets worse and worse, you're going to even have trouble with your more proximal muscles, even though they're shorter nerves that go to those. But so it's going to be always those long nerves. With a peripheral nerve problem, they're going to be affected first, because it's going to be harder to get the signal there, okay? Even like peripheral neuropathy with diabetes, same reason, you start to lose function in the nerve, it's just harder to send a signal a farther distance, and that's why you're going to get this distal to proximal progression, okay? And what happens usually, like this is like in diabetic neuropathy or in Guillain-Barré, as you start to get weakness in the legs, it starts to work its way up to the knees, and once it gets about to your thighs or so, you start to feel it in your hands and fingers, because if you measure the nerve from your lumbar spine down to this point, and you match it up from your neck down to this point, it's based on length, basically. And so once you get, it's about right around the knees when people most of the time start to then have hand problems. So your diabetic patients, if they start to have, you don't get any reflexes of their knee, they're having some knee weakness, then they're probably saying, hey, my hands are starting to feel it too. I've got some wasting in my hands, and then it gets farther and farther up the chain. And then when they recover, though, the recovery is proximal to distal. And so you have maybe a Guillain-Barré patient comes to you, see an outpatient. They may still be wearing AFOs, braces, because their toes aren't and their ankles aren't working, but their hips are pretty good. So you maybe, for the first part of your treatment, you're working a lot of core, a lot of proximal hip stability, exercises. You're just waiting for those ankle muscles to come back. You can't really strengthen them if they can't move them. And you can't use E-stim very well yet either, so you just kind of wait, but you can still work on core stuff, proximal control. Multiple sclerosis, since it's in the central nervous system, doesn't work that way. The central nervous system, if you can damage those, the peripheral nervous system's fine. It's just that you're just going to have regions, like a whole limb could be weak, or a whole side of their body could be weak, depending on where the lesion is. Okay, so MS is very unique because you never know what's going to happen. It could be just their lower leg on the left. It could be their arm on the right. Just depending on where the lesion is in the central nervous system, affecting a pathway that goes to a whole region of their body. Okay. Hypo and hypokalemia. So when you're working in hospitals and so forth, and you're looking at people's lab values, and you're working maybe in a cardiac unit, or wherever, you're a nursing home, the lab value that's most important to look at is probably potassium levels. Why does potassium level be important to look at versus like sodium level? Thinking about what we just talked about with action potentials and also resting membrane. Think about resting membrane potential. Because potassium contributes the most to resting membrane potential, right? And so, because it's leaky, it can move across this. So if you have, this is especially true for rapid changes in potassium. If you have if your lab or blood concentrations of potassium change rapidly, quickly, that can cause all kinds of issues. Arrhythmias, cardiac arrest. You can have weakness in your limbs. You can have, because you're going to affect the excitability of the nervous system and often muscle cells as well, because the potassium is contributing to that resting membrane potential. So if you have wild fluctuations, hyper or hypokalemia, you got to be really careful. If you see somebody's potassium really off the charts, that's where I'm like checking with the nurse, or hey, is this getting better? Are they giving you potassium, or they waited for your potassium levels to come down, that kind of stuff. So potassium's the one that can kill you quick. Sodium can rise and fall a lot and not do much because you just don't have a lot of leaky sodium. It doesn't influence the resting membrane potential nearly as much as potassium does. Okay. I mean, real low levels of sodium, obviously can cause problems, but it's not as quite an emergent event. It doesn't happen as quickly and as rapidly that changes. This is just showing you some of the lesions you might see. These are some of the enhanced lesions in an MS patient here that are associated with some of the inflammation and autoimmune response and the sclerosing. Multiple sclerosis. Sclerosing is like a scarring of that oligodendrocytes that are being affected. Just some other clinical considerations. Some drugs and toxins inhibit sodium channels. Local anesthetics like a lidocaine block, you basically block sodium channels, and that if you block those voltage-gated sodium channels, you can't generate an action potential to create a pain signal. So that's the local kind of blocks those voltage-gated sodium channels. Pufferfish toxin is a powerful inhibitor of sodium channels, and that can kill you if you can't generate an action potential to make your heart go or generate respiratory rate. That can be a problem. So, and you guys will probably get into some stuff with you have pharmacology this semester, right? That's a good complement, because when we started getting into like some of the Medicaid, when we get into Parkinson's disease and some of the neurotransmitters we'll talk about on Tuesday, serotonin, dopamine, all that stuff. You'll be talking about medications that involve dopamine replacement or serotonergic medications. So any questions before the weekend? I'm usually available for email. I won't be doing anything. So if anyone wants to come over and watch football and treat my cat's wound. More than happy to have you. So do load the dishwasher. I had to clean the cat box. I had to take the trash out. I'm like, whoa, this is like a lot of work.